Over in the medical dispute, the Special Committee on Medical Reform will hold its second meeting tomorrow, hoping to seek social consultation. Meanwhile, controversy lingers over the government's plan to permit doctors with foreign licenses to practice medicine during times of a severe healthcare vacuum. Choi Soo-hyung files this report.
Social discussion and medical reform will start in earnest at a second meeting of the Presidential Special Committee on Medical Reform on Friday. The Health Ministry announced on Thursday that medical reform, including the increase in new medical students, is the first step to correct distortions in South Korea's healthcare sector, which has long faced serious problems. Health Minister Cho Kyoo-hong said the ministry will also enhance support for its emergency response system. To fill in a healthcare gap, the Health Ministry plans to allow doctors with foreign licenses to provide medical services here, but only when the healthcare alert level reaches serious, as it is now due to the prolonged walkout by trainee junior doctors. The ministry gave official notice on Wednesday of a revision to the medical law, stating this was to address the shortage of doctors. However, organizations representing doctors immediately criticized the decision, alleging it would bring about a huge decline in the quality of medical services. The ministry will accept opinions on the revision up until May 20th, and it is expected to be implemented as early as the end of this month. Meanwhile, the academic boards at Busan National University, 320 kilometers south of Seoul in Busan, and Jeju National University decided not to revise their internal regulations on increasing the medical school quota. The board said that, as there was no social consensus regarding the increase, they would keep the number of new students at the current levels. The government expressed regret over this, while some experts said it seemed surprised at the unexpected opposition from the key regional hub national universities, which were at the core of the medical school expansion policy. The Education Ministry said that since the government determines medical school quotas, not the schools themselves, their regulations must be revised prior to the implementation of the government policies. If the universities fail to revise their regulations, they could face a suspension of medical school admissions for 2025. So far, out of the 32 universities where medical school quotas have been increased, 12 universities have completed the revision of regulations to reflect this. Choi Soo-hyung, Arirang News.